Let me tell you a little bit about who we are and what we do. We have the only ambulatory surgery center that's been approved by the state of Tennessee for manipulation under anesthesia. We have then got some of the foremost experts, Dr. Robert Gordon, who's also consulting with us. We brought together an osteopath, an interventional pain specialist, of course the chiropractic physicians. And these patients that we were dealing with, already giving standard chiropractic care to, already now providing certain medical services as pain blocks, medial branch, facet blocks, things that are being done in pain centers, pain management centers. We took that model and blended it with manipulation under anesthesia. Some patients need it before, some afterwards. Our interest, of course, is in patient care, conservative patient care, treating the underserved. We're the only ambulatory center in the metropolitan Knoxville area. What we're particularly looking at is while our Lensgraf Clinic Medical Center has ample numbers of patients, we know that the community at large, the chiropractic physicians out there at large, are still looking for that, where to send a patient and how to treat them other than surgeries, if not necessary or needed, endless medications. And what we do here is work with you. We will have training classes for those that need that. We're going to be providing biannual training classes. It'll provide all the credits. It'll cover your CMEs that you're going to have anyway. And at the same time, it's documented and backed by leading chiropractic colleges. And there's a number of physicians that already refer patients to us in general. And those chiropractors that do, you're welcome to get a list of those from us that historically they know they'll get their patients back. We're not interested here in doing your chiropractic work. We want you to do your chiropractic. We want here to do the other extra things, the blocks I've mentioned, the manipulation under anesthesia, and even better yet, you get trained, you bring your patient here, and you bring your own patient in, and you perform the service here. The patient gets to see you before they go under. You'll be there when they get up. You'll have that follow-up care, because afterwards we recommend 6 weeks of follow-up physical medicine at your clinic. That needs to be followed up. That is part of the requirements. I've had a lifetime of chiropractic. My father was a chiropractor, and of course some 28 members of my family were chiropractors. So I've had a lifetime of chiropractic. At the same time, I finally reached an end to the response to standard chiropractic for a lower neck and shoulder problem. It was just relentless with me. It just would not change. I thought, man, I don't want to do another 20 years like this. I had some pain blocks, I had some injections, but I did 3 days of MUA, and that was over a year ago. And since then, I'm at least 85%. I thought 100%, but like everything, you can't fix things forever. And this very weekend, I intend to have one day visit, and I think that'll get that last 10% that nags. But during this time, it was fun to watch other patients, because I've had a lifetime. I take pretty good care of myself, do all the health, the nutrition, all this stuff, and yet there's a limitation, as we all know, a limitation of matter. But when you see a patient that I've saw that other chiropractors already brought here, who walk in so curved over and so bent over, I myself thought, oh man, this could be a case that I don't know about. But at the end of the 3 days, they were like straighter and straighter, looking better. You could look them in the eye, see the differences. It was pretty exciting for me, and I've been around a lifetime of watching patients get results. Sometimes as doctors, when patients tell you how much they appreciate you've helped them, you gotta really stop and appreciate that they're trying to thank you, instead of, like I've seen some doctors, patients following them down the hall going, thank you, I really appreciate this. Yeah, okay, kind of like pass the butter. But let me tell you, when they start telling about these results, you can see it. It's truly visible, and in 3 days, it's like a lifetime of problems go away. That's all I can say.